You must have come across some calcium channel blockers like Amlodipine and the rest, but the whole science has refused to sit on your head. That's not a big deal. I have the solution to your problem. In this video, I'm going to simplify calcium channel blockers the way that you're going to understand it, and it's not going to leave your brain again. Now, what are calcium channel blockers and why do we use them in nursing? What are the indications? What are the side effects and contraindications? We're going to learn about all that in this video. Let's go ahead and talk about it. Calcium channel blockers are medications that block the entrance of calcium ion into the cardiac cell or other smooth muscle cells in the body. And by doing so, they reduce muscle contraction, leading to vasodilation and an overall reduced workload on the heart. What does this calcium do? The calcium is needed for muscle contraction, and that's why it's needed in the stimulation of the contraction of the cardiac muscles and also some smooth muscles. But in a situation whereby the heart is being overstimulated, these calcium ions have to be blocked. They don't cause overstimulation of the heart, which will lead to hypertension and in turn lead to left ventricular hypertrophy. Now let's see the class this medication belongs to. Calcium channel blockers belong to the class of medications we call antihypertensives, and we can also classify them as anti-angina drugs. That is to say that it is used in the management of myocardial infarction, otherwise known as heart attack. Let me know in the comment section if you want me to talk about myocardial infarction or heart attack. Now, let's go into the mechanism of action of this medication. So let's dive in and look at what the mechanism of action is. Calcium channel blockers cause vasodilation, thereby reducing peripheral resistance and overall blood pressure. And we all know that one of the causes of hypertension is peripheral resistance. That is to say that some blood vessels in the body could be stiff, which could lead to constriction. So what these calcium channel blockers do is to go and dilate those blood vessels so that it's going to reduce peripheral resistance. And when there's less peripheral resistance, the blood pressure tends to drop. You can see that your nursing objective has been achieved. Also, other ways by which these calcium channel blockers reduce blood pressure, and one of them is that they slow down AV node conduction, thereby reducing heart rate and decreasing myocardial contractility, thereby improving the outcomes of myocardial infarction and angina. Let me know in the comment section if you want me to talk about the AV node and how it plays a role in the contractility of the heart. Now let's look at another way in which this medication can act on the body. The overall effect of this medication leads to reduced oxygen demand and increased oxygen supply to the heart. Now, let's look at the case of myocardial infarction or heart attack. There is decreased oxygen supply to the heart muscle, so it calls for more oxygen demand. And because there is more oxygen demand, the workload of the heart could increase. That's why when we use calcium channel blockers, it helps to supply more oxygen to the heart, thereby reducing the oxygen demand and the overall workload of the heart. By this, you've seen two indications of calcium channel blockers, which are hypertension and myocardial infarction. Now, let's dive fully into the indications for calcium channel blockers. Remember the first one, which is hypertension. In fact, calcium channel blockers are typical antihypertensive. So, you can't dispute the fact that one of the major indications of calcium channel blockers is hypertension. Number two, we have angina pectoris, which is a symptom of myocardial infarction. Let me know in the comment section if you want me to talk about myocardial infarction and angina pectoris. And then the third one is Raynaud's phenomenon. Raynaud's phenomenon is one of the commonest questions you may see in your NCLEX. So you also let me know in the comment section if you want me to talk about Raynaud's phenomenon. And the fourth one is hypertrophic cardiomyopathies, which comes as a result of myocardial infarction or hypertension. Now that we've known the indications of these medications, let's go ahead and look at the types of medications that fall under calcium channel blockers. And I'm going to give you a cheat code. Most of these medications end in pine, that is P-I-N-E. So when you see a medication that ends with pine, it could be that medication is a calcium channel blocker, which is a typical antihypertensive. Now let's go ahead and look at some of the examples we have here. We have Amlodipine, Nifedipine, Phenodipine, Isradipine, Clevidipine, and so on. There are also some calcium channel blockers that do not end in pain, and these include Verapamil and so on and so forth. That's why you see a medication, it's important to read the leaflet and know what that medication is all about. There are common side effects most watch for when your patient is taking antihypertensives like the calcium channel blockers. The first one is hypotension. Remember that calcium channel blockers are antihypertensives and their job is to reduce blood pressure. You want to monitor your patient's blood pressure to know whether this patient is being hypertensive or there is a case of hypotension so that you don't crash the patient's blood pressure. Because the patient's life is important and your license is also important. We also have other side effects like headache, flushing, ankle edema, dizziness, and constipation. You want to make sure that this patient is taking adequate food so that the patient is not going to have constipation. You can also include food with high fibers into the patient's diet so that this patient is not going to have constipation. Now, what are the contraindications? Because calcium channel blockers are antihypertensives, the first and most important contraindications you want to look at is hypotension. If the patient's blood pressure is below 120/80, it withholds any kind of antihypertensive, be it a calcium channel blockers, AC inhibitors, any other kind of antihypertensive you want to talk about. make sure you withhold it because it could crash the patient's blood pressure, and you don't want this for your patients. Other contraindications include bradycardia and cardiogenic shock. Let me know in the comment section if you want me to talk about cardiogenic shock. And then you could also have other contraindications like acute heart failure. And one thing you want to take note of is that it is very risky to combine calcium channel blockers with beta blockers because it could cause severe cardiac arrhythmia or even severe hypotension. So if your patient is on beta blockers, you may want to withhold calcium channel blockers so that you save the life of these patients. Here are some tips you want to take note of if your patient is taking any kind of calcium channel blockers. The first one is that you must monitor this patient's blood pressure before and after taking the medication. Now, monitoring blood pressure is a routine practice we do in nursing, but then because this patient is taking an antihypertensive, you have to monitor it regularly before and after you take this medication because it tells you how the body deals with the hypertension. Think of a scenario whereby the patient's blood pressure is already low and then you administer calcium channel blockers. What will happen? It's going to crash further, and you don't want that for your patient. And your license is also very important because you have to protect your patient and the same way protect your license. Like your life depends on it. Now, another thing you want to do is that you have to check the epical pulse of this patient. Yeah, epical pulse must be monitored, and if the heartbeat is less than 60 beats per minute, you want to withhold calcium channel blocker because it will further decrease the heart rate of this patient, which can also lead to shock. And then you have to educate your patient on constipation because it is one of the side effects that is associated with calcium channel blockers. Make sure the patient is adequately hydrated and the patient is taking a diet that is high in fiber so that this patient is not going to have constipation. That will be all for now. Do well to like this video and share to your nursing communities. And don't forget to subscribe to my channel so that you don't miss out on any of my uploads. And until then, let me know in the comment section if there's any other topic you want me to talk about in nursing.